Welcome, everyone, to Agricultural Worker Health 101, presented by the Farm Worker Health Network. We are excited to have you here with us today. My name is Alexis Guild. I am with Farm Worker Justice, and I am joined here by my colleagues Nadine Mikhail from Health Outreach Partners and Monica Calderon from MHP Salud, as well as others from the Farm Worker Health Network. So this webinar is hosted by the Farm Worker Health Network. There's a lot of content in this webinar. We will be going through all of the content, and there'll be time at the end for Q&A. So we ask you to hold your Q&A to the end of the webinar and to please put any questions you have into the Q&A pod, and then we will get to those at the end. The Farm Worker Health Network, we are six organizations who receive funding from the Health Resources and Services Administration to provide training and technical assistance to health centers, specifically health centers that serve agricultural workers and their families. And so the six national organizations are Farm Worker Justice, Health Outreach Partners, MHP Salud, the National Association of Community Health Centers, Migrant Clinicians Network, and National Center for Farm Worker Health. And we will share more about our organizations and the training and technical assistance we provide at the end of the webinar. The webinar will have a few components to it. We are going to start off by setting the foundation, sharing information about ag worker health, and then we will talk a little bit about the population. We'll share information about health needs, risks, and challenges, and resilience. And then we will share information about the resources available to all of you from our different organizations. So, as many of you, I'm sure, are aware, the health center program for agricultural workers predates the community health center program. It was actually begun in 1962. The community health centers came about in 1965. And this timeline really just shares information about the different milestones as we think about health centers and we think about agricultural workers. So we talk about the Agricultural Worker Protection Act, which we'll talk a little bit more about in a moment, the Worker Protection Standard, and of course the Affordable Care Act, and then other important milestones for health centers and agricultural workers. As many of you may be aware, there are federal regulations, of course, that oversee the workplaces of our nation's workers. However, there are many labor laws that do not include agriculture. And so these include parts of the Fair Labor Standards Act, for example, child labor. So it is, you can be as young as 12 and legally work in the fields. Workers' compensation and minimum wage, and then OSHA standards. So I'll be talking a little bit more about workers' compensation and OSHA standards. So there are various protections that are overseen by the Occupational Safety and Health Administration. These protections ensure that workers are in a healthy and safe working environment. The regulations that oversee agricultural fields are the Field Sanitation Standard, and this was created in 1987. It requires that there is potable drinking water, toilets, and hand washing facilities in the fields within range of workers. There are standards in terms of how far those toilets and the hand washing stations and drinking water can be. And that is to ensure, of course, that workers maintain good hygiene, are keeping themselves safe and healthy while working in the fields, and that they have access to water and to toilets. Then there is also the Worker Protection Standard. This is actually under the Environmental Protection Agency. The Worker Protection Standard essentially has to do with pesticide protections. So it requires employers to put in place certain protections for those who handle and spray pesticides. It requires annual pesticide trainings to workers. And it also sets out standards in terms of when workers can enter certain areas that have been treated with pesticides. Those are the primary occupational safety and health protections. Um, some states do have additional protections. So the ones I will highlight are around wildfire and heat. So three states have regulations in place to protect workers from wildfires. Those states are California, Oregon, and Washington. All of these standards are slightly different, but essentially they require employers to provide respirators and put in place other precautions during a wildfire. And these were all put in place in the last 5 years or so, or within the last 5 years. And then there are currently a handful of states that have a heat standard. Those states are California, Oregon, Colorado, Washington, Maryland, Minnesota, and Nevada. Maryland and Nevada are the two newest states with a heat standard. The Minnesota heat standard is only for indoor workers. But other states do not have a heat standard. There's also no federal heat standard, and there's no federal wildfire standard. The Migratory and Seasonal Agricultural Worker Protection Act, this we are highlighting because it does provide basic labor protections for workers who work under labor contractors. So many agricultural workers do work with farm labor contractors, and so this particular act provides protections for those workers who work under farm labor contractors. It does not include H-2A workers, and so these protections are for U.S. workers. And then for workers' compensation, in your state, agricultural workers may or may not be covered under workers' compensation. Each state has a different degree of protection in terms of workers' compensation for agricultural workers. So only 14 states require full workers' compensation coverage for agricultural workers. In other states, it's either limited or optional. And there is a guide that was created that provides more information about workers' compensation. It's important to note that H-2A workers do have full workers' compensation, regardless of the state coverage for workers' compensation for agricultural workers. So, what is the 330 program? So, we are talking about health centers that serve agricultural workers. These health centers are under what is called the 330 program. So essentially, it's a section of the Public Health Service Act. And in this section, it essentially authorized the health center program, which is under the umbrella of the Health Resources and Services Administration within the Department of Health and Human Services. In 2022, the Bureau of Primary Healthcare, which is the bureau within the Health Resources and Services Administration that oversees the health center program, supported over 1,400 health centers, and they operate approximately 15,000 delivery sites. So there are a lot of health centers out there in the U.S. And in the territories. In 2022, 175 of those health centers were funded to serve migratory and seasonal agricultural workers. And according to the data collected by the Bureau of Primary Healthcare, in 2022, there were just under 1 million agricultural workers and their families who reported being served at a health center. in 2022. So, who is an agricultural worker for purposes of the 330G program, which is the section of the Public Health Service Act that specifically talks about health centers that serve agricultural workers and their families. So, the health centers to be designated as 330G, they define an agricultural worker as a migratory worker, a seasonal agricultural worker, or an aged and disabled agricultural worker. So these are the definitions specific to the health to the Public Health Service Act. Other agencies may have different definitions for agricultural worker, but when you're at your health center and trying to determine who is an agricultural worker for purposes of Section 330G, these are the definitions to use. So, a migratory agricultural worker is defined as someone whose principal employment is in agriculture. They've been employed in agriculture within the last 24 months, and they establish a temporary home for the purposes of their employment in agriculture. A seasonal agricultural worker is defined as someone whose principal employment is in agriculture, but on a seasonal basis. But they do not migrate, they do not move in order to find their work. They stay within the same area. And then there are the aged and disabled agricultural workers who, either due to disability or age, have worked in agriculture previously, but no longer work in agriculture today. And this also includes their family members as well. So in order to determine who exactly, is an agricultural worker, what is agriculture when we think about it? The Health Resources and Services Administration use what's called the North American Industrial Classification System. And so within this system, it has various job codes. And so the job codes for agriculture, in terms of the definition used by HRSA, are crop production, animal production, and aquaculture, and then supporting activities for crop production and animal production. So anyone who works within these different areas, and these different subcategories are included, they are considered agricultural workers. So who is not considered eligible for 330G services? And this does not mean that your health center cannot see these workers. All it means is that in terms of tracking who are the agricultural workers who your health center is serving, these are industries where if they come in and this is their principal employment, they do not count as agricultural workers for purposes of counting the number of workers, agricultural workers, and family members under 330G. So that includes spectator sporting, the transportation of livestock, trucking timber, landscaping, and meat product, meat processing, poultry processing. Those are not included and as eligible for services under 330G. They would be eligible for services under the General Community Health Center program. Dairy workers are considered agricultural workers because they do work in the cultivation of milk. So they are considered, but it can get a little fuzzy. And the National Center for Farm Worker Health has a lot of great information that really goes into detail about agricultural workers, who they are, who is eligible, and what those definitions are. So I certainly encourage you to go to the National Center for Farm Worker Health with more information about the definitions. There are many, many health centers that fall under 330G. As we said, there are 175 health centers that receive funding under 330G, but then there are also satellite sites. And so many of you may be from a health center system where your health center perhaps gets 330G funding, and then there are other health centers also in your health center system, other sites that serve those who are unhoused, public housing, and others. And so, as you can see from this map, there are, of course, concentrations of 330G grantees in areas with high agricultural production. So, California, Florida, the Carolinas, the Pacific Northwest, and the Midwest. But there are 330G grantees across the country. And as a 330 program, there are services that you are required to provide. So this includes primary care services, preventive services, emergency services, pharmacy, outreach and enabling, the sliding fee scale. That's really important for 330 because that is what allows uninsured and underinsured individuals to be able to access healthcare and afford healthcare at the health center. And then, of course, there's the patient majority governing board. And every single health center system has a slightly different sliding fee scale because it is set by the health center system. But that sliding fee scale is a requirement of a 330 program. Health center budgets range from anywhere between $500,000 and $25 million. So there are health centers that may have one or two sites and are small and have smaller budgets. And then there are health centers that have 40, 50 sites and have a budget in the millions. And all of these health centers do receive funding from the Bureau of Primary Health Care. They receive some funding from the Bureau of Primary Health Care. Generally, it's approximately about 28% of the health center's total budget. Other funding sources come from Medicaid, Medicare, private insurance, and then other funding sources. And with that, I am going to turn it over to Nadine, who will be talking about the agricultural worker population.
Thank you so much, Alexis. So yes, now we're going to talk more about the population and share some demographic information. Right. So here we have some data points to share. First of all, there's around 2.5 million people, agricultural workers in the US at the moment. And if you consider their family members as well, that would reach around 4 million. And this was from a study from a few years ago. So this is just an estimate. It is more very likely that there are more agricultural workers, and because of the constant mobility, it is sometimes hard to collect this data. So this is just a minimum estimate there. 68% of them are considered male and 32% identify as female. And it is quite a young population with 42% under the age of 35. Many of them are between the ages of 20 to 34 years old. And as Alexis mentioned, agricultural workers can be as young as 12 years old. And so it is a very young population there. So in terms of education level, the agricultural workers on average have a ninth grade education level. They do belong to low income families, so mean and median individual income range is from 20,000 to 25,000, and 1 in 5, so 21% of agricultural worker families have a total family income below 100% of the federal poverty level. And when it comes to health care and health insurance and accessing them, 48% have reported that they do not have health insurance and they do not have access to preventive health care, with 40% having not visited a U.S. healthcare provider in the last year. So in terms of the H-2A program, it allows U.S. employers or U.S. agents who meet specific regulatory requirements to bring in foreign nationals to the United States to fill temporary agricultural jobs. So for the time being, there's around 400,000 H-2A positions that were certified by the Department of Labor in 2024. So employers do need to apply to the Department of Labor to show that they do not have enough US workers to fill these jobs. And currently, there's no cap on the number of H-2A visas issued, and the program has doubled in the last 6 years. Employers must provide transportation, housing, workers' compensation, and a minimum wage rate. And H-2A workers are eligible to enroll in health insurance through the Affordable Care Act marketplace and tax credits or subsidies to lower the cost of health insurance. So this is a map that highlights the states with the highest population of farm workers, and it really does correlate as well with the map we saw earlier on the number of FQHCs. So California is not surprisingly over 1 million of the nation's farm workers exist there, so it's very densely populated there. And that is followed by Texas, Washington, Oregon, and Florida. And as you can see, the concentration of agricultural workers is highest in the West Coast. So in terms of the migratory aspect, those would usually seek annual employment and they will follow the harvest season from region to region. So this trek often requires them to relocate several times a year, and they can work with many crops in different locations here. So for example, a migrant farm worker can harvest citrus during the winter in Florida and then relocate to North Carolina to help with lettuce during the spring. And then the seasonal aspect is that they may remain in one location for work, and they are often employed for a few seasons out of the year. And for example, they may not be involved in several stages of the production for the same crop. So there are three patterns of mobility usually. So there's this restricted circuit, there's point to point, and then there's nomadic. So for the restricted circuit, many farm workers travel throughout a season within a relatively small geographic area. So for example, restricted circuit migration occurs within the California Central Valley, along Nebraska's Interstate 80, or during harvesting season in Texas El Paso. And then you have point to point. So here you have another group of farm workers who will migrate to the same place or a series of places along a fixed route during the course of a season. And these people tend to live in home-based areas like Florida, Texas, Mexico, Puerto Rico, or California. And then you have nomadic, which is where farm workers travel away from their home for long periods of time, sometimes many years, and they work from farm to farm or crop to crop, and some of these farm workers may settle in the area where they migrated, but others return usually to their home-based state or their country of origin. And now I will pass it on to Monica, and she will discuss health needs, risks, and challenges of agricultural workers.
Hello, everyone. So we'll now get into understanding what makes up our agricultural worker community, and we'll touch issues affecting their health. We see here what impacts agricultural worker health. We see that living conditions often are significantly impacted by the quality of housing conditions. We also look at long working hours, exposure to pesticides, limited access to healthcare or language barriers. So we see living conditions, mental health, and physical health being definitely and impacting on their overall well-being. We also can think about those areas and how we see it impact continuity of care. And then we also look at other areas like regulatory issues, definitely the exposure to their everyday environment and how that impacts overall well-being. We also look at work-related health risks. Risks of injury is very common in risking their health for agricultural workers. And so the following are lists of work-related health risks that are common in the community. We have musculoskeletal injuries, which can be awkward positions, repetitive work. It impacts their mobility, back, knee, exposes them to wrist pain, and other bodily issues. And then we have heat stress because of the working conditions and the different degrees that they're exposed. For example, being out in 100-degree weather, sometimes without, having enough breaks, access to water, or having the appropriate clothing to protect them, definitely has an overall impact. Uh, Farm equipment, the quality of the equipment that they're handling also poses a risk to their overall well-being. Transportation to and from work, how they're commuting, the quality of that commuting, the frequency, um, also does impact. Lacerations from sharp equipment, we can see that is also, exposes them to having um, work injuries, and if they're also left untreated or delayed in accessing help in addressing those injuries, can also impact their overall quality. Exposure to slips, trips, and falls, we see again it impacting their overall well-being. And so we see different areas: eye injuries, uh, insect, rodent, snake bites, ant bites, and snake bites definitely have that overall impact on well-being. So just constantly being exposed to different work-related risks does influence how well they're able to work, and then also have access to care. How that also has an overlapping consequence on their overall well-being. In addition, oh, sorry, I skipped a slide. In addition, we see here that there's a graph that does represent the number of fatal work injuries by the industry. Although this data is from 2022, the graph does shed light on how dangerous agricultural work really is. So we see that besides some of that information that we covered on the previous slide, there is, agricultural work is the fourth most common profession to have work-related fatal injuries. It's the highest number of injuries that often are stemming from the different areas that often expose farm workers to leading to having more serious and complicated injuries out in the field that can result in death. And we see that there is an increase in that. The highest rate of fatal injuries is at 18.6%, which is 100,000 full-time workers. So in other words, these agricultural workers are more likely to be fatally injured on the job than in any other profession, shedding light even more on the importance of having to have those proactive measures in place for reducing these work-related injuries. In 2022, 417 ag workers died of work-related injuries. And so that in itself is alarming. We're unsure how accurate this number is for reasons, but we do know that usually that's stemmed to underreporting, and we really don't know the number. But even in that number in itself is alarming. What often happens is that deaths do actually go unaccounted for and often are attributed to something else. But thinking about those work-related injuries and the different environments that they're exposed to, we see that, again, those proactive measures and causing the awareness is very important. Another area is pesticide exposure in the fields and at home. And so pesticide exposure is a risk both in the field and at home. We know that the drift is the #1 source of exposure to pesticides. And pesticides affect not only those that directly apply the pesticides, but the farm workers who pick the crops after it has been sprayed, and then it affects the family through take-home exposure. We know that it sticks directly on their clothing, their shoes, their work vehicles. And then we also think about having access to being able to maintain their work and equipment and gear um, in sanitary way so that exposure gets reduced. So pesticides are also found in groundwater. So the EPA estimates that about 10,000 to 20,000 agricultural workers per year are are poisoned on the job due to pesticide exposure. Again, this is likely an underestimated count because pesticide poisoning is, again, largely unreported. And we know that this can go unreported because agricultural workers may not seek medical care for mild or moderate symptoms, and sometimes can be misdiagnosed from providers because the symptoms of pesticide poisoning can appear similar to other illnesses, such as the flu or food poisoning. Unavailability of clinical diagnostic tests also is a contributing factor for identifying acute pesticide poisoning. So we think about those other factors that also are linked to this. What is the access to the healthcare that they could have? What other sicknesses or types of exposures can mimic other conditions like the flu or food poisoning? And again, sometimes pesticide exposure can be misdiagnosed. So again, that awareness is very helpful to be informed of what this can look like. As we go into the physical aspect, we think again about how agricultural work, physical issues are not very different from the general population. But agricultural workers do have compound challenges and barriers due to their lifestyles and the living conditions that we've covered that can definitely exacerbate their health conditions. And the health issues that they face are often and very much so linked to because of their mobility. And in general, we also think about that access to care that's also oftentimes limited and unreported cases or experiences that are linked to properly tracking what is linked to physical health and the migratory and mobile populations. As we go on to management of the health concerns that are experienced by migratory seasonal agricultural workers, we think about some of these that are noted here: diabetes, hypertension, cancer. Um, we have other areas similar, again, that these are shared health concerns to other general populations and other Hispanic Latino populations. Agricultural workers do face high rates of diabetes and hypertension and cancer, which are often and more primarily the focus areas when it involves outreach and efforts to get that medical intervention to the population. And those usually are seen because of lack of access and challenges for medical interventions, which can sometimes complicate the symptoms. Um, and then we see also the mobility of the population. They can't continue the treatment that they start. So they often have a hard time accessing treatment and hard time to offer treatment considering the nature of their work and having to travel. So there are limited programs for agricultural workers that have services that they travel and the around as they continue their work. So in regards to mental health is a huge issue among agricultural workers. That that does not receive the necessary attention that it deserves. Just like anyone else, you may see workers suffering from anxiety, depression, stress, substance abuse or use disorders, and family violence. And that just sheds light that screening for mental health challenges and providing care is a very crucial part of treating the patient as a whole. for many reasons, there is a huge stigma around mental health in the ag worker communities. And so especially among Hispanic Latino agricultural workers, and this can be due to different cultural related or belief systems, including familismo, paternalismo, machismo. And we just want to remember that agricultural workers are often not going to tell you, about how they're feeling or if they recognize it as anxiety. And they may definitely refer to it in different experiences. We can hear terms like son nervios, I'm nervous, or different areas that ways of saying that they experience stress, depression, or anxiety. So it's important to keep this in mind when working with our agricultural population, that it can look differently and feel differently, but it is something that we still want to be able to offer that support and attention and connect them to the appropriate resources. And so illnesses that are related to standard substandard housing, we see that that's linked to the living challenges and the different circumstances that can impact the quality of the housing that they have access to. And so that this has definitely an impact on their physical, mental health, and emotional well-being. Some of those are due to overcrowding, being poorly maintained, or hygienic conditions. We see that the housing standards often bring with the risk of illnesses that are associated to the living conditions that our communities live in. And these can be uh, provide a pathway for disease to spread easily between workers. Um, we see infectious diseases, conjunctivitis, other health-related issues that can often transmit from one person to another. We also see lead poisoning as one of the areas that can be found that's related to living conditions. So agricultural worker housing does range in different forms. We have labor camps, apartments, trailers. Some ag workers may even resort to living in tents, vans, or cars if there's no other affordable type of housing available. And so because of this, farm workers frequently squeeze in as many people as they can into a single unit, and that does also pose serious health risks and creates opportunities for those transmission rates to be impacted. Um, and so a lack of modern convenience such as indoor plumbing and heating is also a common added factor that adds to the health risks faced by farm workers. And here we see that other additional areas that also impact is that we know that there is a strong need for care and access to other services. And ag workers face many barriers to care. And some of the barriers that this population faces, although the list is not as exhaustive, we know that some of those areas are language, and we have lack of support, and food insecurity, poverty, mobility, confusion about U.S. health systems, and limited job security. And those things can look differently when we think about language. We think about the different rise in indigenous languages. Farm workers have unique beliefs about health and seeking medical care that also tend to be turned more into holistic methods versus Western medicine. And we also see, again, in going a little bit more in depth of what that means for food insecurity, farm workers cannot access or afford healthy foods that they might even harvest. And so that's also just ties into that lack of support that's often involved, and from being in this situations. So again, shedding light on all of those areas When we think about poverty, it's linked to subsidized different housing, accessibility, as mentioned before, the lack of insurance, unable to afford medication or necessary medical supplies. And then we have that limited job security, which sometimes they have no sick leave, making it more difficult for them to make a decision whether they want to take the time off to access healthcare or they continue working. And so that definitely puts them in a difficult position, either to lose wage or continue on and spend money on their healthcare and put at risk what they bring home to their family. Some emerging issues that impact migrant seasonal agricultural workers. We do look at the lack of information or information coming in very slowly about disasters and other public health emergencies, such as the case was for emerging and occurring respiratory infections in farm worker communities. So we see that lack of health insurance makes it more difficult for access to testing or treatment and clinical interventions to be more accessible. And so respiratory infections such as H5N1 were also something that was mentioned as one of the emerging issues that impacted health outcomes, along with what we see mentioned here. We see how important it is to have that emergency preparedness, the planning and response efforts in place, being mindful of the weather changes, and tracking infectious and vector-borne disease rates, as well as other environmental hazards. So there's just a lot of areas where, even though they might be current, because of the rate increase, they've become emerging issues once again. Okay, and I will pass it on to Nadine.
Thank you, Monica. So to talk a bit more as well about some service delivery challenges, we have, of course, continuity of care, where agricultural workers may seek care only when necessary. So they're less likely to look into preventive care services. Additionally, agricultural workers may be moving during treatment, so that can alter the continuation of the treatment plan that they've been given. And communication between MHCs and other providers is also difficult. And then you have access to high quality healthcare, where it's important that there is provision of multilingual services, whether that's at reception, whether that's with health education, prescriptions, having bilingual staff and translators on hand, and of course, ensuring that there's relevant training and continuing education for staff members who serve agricultural workers. And then when we're looking at other service delivery challenges in operations, the integration of walk-in patients into the appointment system is important. Health center hours of operation, whether that fits as well with the agricultural workers' work schedule and commitments, the demand and capacity for providers, and then provision of transportation in rural areas where that is very difficult. And then, of course, costs. MHCs must remain competitive despite the escalating costs in the healthcare industry. And of course, lack of insurance coverage for this population does make medical costs a barrier for them. And then outreach and enabling services are often not reimbursable. So let's explore some effective adaptations for mobility. And here we have, for mobility adaptations, it is important to have portable medical records and bridge case management. So that means having electronic health records transmissible from one health center to the next, especially when we have folks moving from one place to the next. And of course, appropriate service delivery models as well, where we have case management, having lay health promoters, promotores on hand, outreach and enabling services, coordination with schools and work sites, having mobile units, and of course, ensuring person-centered care. And when we look at having easy access to care, it means four main things. First, we want to make sure we're orienting all patients to the scheduling protocols, and we have to recognize that patients may be unfamiliar with scheduling practices or the US healthcare system in general. It's important that we try to document the numbers of agricultural workers in your area by month, the typical work hours, the kind of transportation options they have. And of course, thirdly, the open access scheduling permits and influx of mobile agricultural worker patients to be seen, especially during seasonal variances. And of course, we want to make sure we're accommodating the working hours, the transportation services available, and geographic barriers that are experienced by mobile workers. Now, there are some agricultural worker communities in the US that cannot be adequately served by the traditional health care service delivery model. And the conditions or circumstances that usually contribute to this include the geographic areas of the country, the number or the density of migratory seasonal agricultural workers does not justify establishing or supporting a health center. Maybe the agricultural demands bring MSAWs in small numbers for a long period of time or in large numbers for a very short period of time. Or you have MSAWs who exist in relatively large numbers, but they're very widely dispersed. So these are unique conditions that are recognized around the country, and the Health Center program provides flexibility in implementing a service delivery model to fill in the gap in services. So here is where the voucher model service system in health centers come to play. And it is an alternative model to a freestanding health center. So this voucher model differs from the traditional health center in that the services are provided indirectly through service agreements with primary care centers and rather than directly as with most health centers. In addition, while health centers provide care to patients in their immediate service area, health centers that are operating a voucher model can extend these services into communities, often throughout an entire state, ensuring the access to primary and preventive healthcare services are nearer to the places where these MSAWs live and work. So currently we have 16 voucher programs and NCFH has an LC on this subject. Now, partnerships are so crucial. You don't have to do this work alone. So we encourage you to look at other partners in your community, like employers, schools, faith-based organizations, other community-based organizations, and outreach organizations to maximize the resources and use all the services available to reach this population and prevent duplication of efforts. And this will expand the resources available to you and also to the partners in the community. Now, here's the last part of our webinar. We're going to share some resources offered to you for training and technical assistance. So on this slide, you'll see some of these resources. Again, here are the 6 organizations that make up the Farm Worker Health Network and their respective websites. If you're looking for help for technical assistance, you can definitely reach out to these organizations, and I will pass it on to MCN to talk a little bit more about what they offer.
Thank you so much. Hi, everyone. This is Martha with MCN, Migrant Clinicians Network. Really quickly, we are a force for health justice. Our mission is to create practical solutions at the intersection of vulnerability, migration, and health. And again, at MCN, we envision a world based on health justice and equity, where migration is never an impediment to well-being. Be sure to connect with us by following us on our various social media platforms, attending our webinar, subscribing to our blog, and accessing our resources. If for whatever reason you cannot find the resource you're looking for on our website, just reach out to us for some assistance. Oops. And finally, remember to leave us a review on, oh, I missed it again. Leave us a review on Great Nonprofits. Let us know how MCN helped you. If you happen to be familiar with our health network program, just give us a little review and tell us about your experience. And again, just let us know what you love about MCN and the work that we do. And with that, I'm going to pass it on to, I forget who I'm passing it on to, but whoever's next. Thank you.
Thanks, Martha. That would be me, and I'll talk a little bit more about Health Outreach Partners. So we are a nonprofit organization. We're based in Oakland, California. We are a national training and technical assistance partner. So we provide trainings, resources, consultations, workshops, and webinars across the nation. And we mainly serve community health centers, primary care associations, and safety net health organization. Our main mission is to respond to the community's needs by equipping health partners such as yourselves with relevant strategic knowledge and tools to transform communities from the ground up, resulting in a healthy and equitable society. And in the next slide, we have here some of the services that we offer again, and we do offer curriculums, toolkits, and starter kits, for example, on transportation and quality improvement. We have something on outreach and enrollment as well. We do have trainings on that. We have manuals, articles, and some innovative outreach practices and case studies offered as well. These are some of the topics we cover. Right. We also have organizational self-care for retention and recruitment of workforce. We have program planning and evaluation strategies. We also have the business value of outreach. So how can we help advocate for integrating outreach programs into health centers and showing this in real dollar amounts, how it can be profitable for a health center. We also do work on access to transportation and, of course, healing-centered motivational interviewing for screenings. And here's our website at the end there if you'd like to reach out to us. And now I will pass it on to Alexis.
Thanks, Nadine. And Monica had to hop off, so I will be talking about MHP Salud. So MHP Salud, they are deeply embedded in the communities that they serve. Their focus is on community health workers and on supporting resources to promote the use of community health the use of community health workers in health centers. So as you can see, they have a very large impact. They reach nearly 123,000 individuals a month. They have 50 plus training and technical assistance sessions, and they have trained nearly 100 community health workers. And the training and technical assistance that they provide include really support to build and strengthen community health worker initiatives at health centers, as well as departments of health, hospitals, community-based organizations, and other areas where community health workers are working in their communities. And this is their website, as well as a QR code for their resources. And also their social media handles. And then Farm Worker Justice. So this is my organization. We are a national nonprofit. We aim to empower farm workers and their families to improve their living and working conditions. We engage in a multifaceted approach. We engage in training and technical assistance, as well as coalition building and public education. We are based in Washington, D.C. And as a national training and technical assistance partner, our training and technical assistance really focuses on community mobilization. So promoting healthcare utilization by agricultural workers and their families by working with community partners outside of the health center. And then information dissemination, including materials and resources for health center staff, as well as for community health workers and farm workers themselves. And here are some of the resources, and we have issue briefs, fact sheets, training of trainer curricula. We have materials in numerous languages, including English, Spanish, Haitian Creole, and Indigenous languages on a variety of topics. And our website can be found on this slide. And I will turn it over to Esley to talk about the National Center for Farm Worker Health.
Thanks, Alexis. Hello, everyone. The National Center for Farm Worker Health is a private nonprofit organization. We are located in Buda, Texas, which is about 15 minutes away from Austin. Our mission is to improve the health of farm worker families, and a lot of our efforts are to improve the life and well-being of agricultural workers. We do have an Ag Worker Access campaign, and you can find more information in the QR code on the slide. Our goal is to increase the number of agricultural workers and their families that are served in community and migrant health centers to 2 million. So we have diverse types of organizations that have joined the campaign and work together for this great population. So next slide, please. In our website, you will find a lot of the work that we do. We have a lot of population-specific data about demographics, research, different fact sheets on priority topics for agricultural workers. We also develop a lot of patient health education materials in English and Spanish and other indigenous languages that represent this population. We have some resource hubs, mental health, diabetes, social determinants of health, and we also have some other materials that are digital, such as digital stories, fotonovelas that could help education efforts. And lastly, we have Call for Health, which is a helpline that is available nationally for all agricultural workers who need to connect to or access healthcare services. Next slide, please. Apart from doing all of the educational materials, we also have workforce development, we have trainings, webinars, learning collaboratives designed for organization capacity building all around agricultural workers. We also have one of our symposias coming up. So if you want to learn more, I'll share the link in a bit. And lastly, we do a lot of governance trainings. We have strategic planning and other types of technical and training assistance for organizations. Next slide, please. And I'll pass it back to you, Alexis.
Oh, sorry, Esley. Thank you, Esley, and please also put NCFH's website into the chat as well, so people can access your website. And then finally, there is the National Association of Community Health Centers. They are a national association. They represent and work with health centers across the country. Many of you, I'm sure, are familiar with them. A lot of their work is around health center operations and governance. So they provide training and technical assistance in various content to support health center operations. They have various different modalities that they use, including, of course, in-person networking, conferences, national webinars, self-paced learning modules, micro-learning videos, and issue briefs. And I do want to note that, as you have heard, all of us represent these various organizations, and there are 6 organizations who do provide training and technical assistance for agricultural workers and health centers that serve agricultural workers. But as I hope you have heard, every organization has its own expertise and its own niche. But we also work collaboratively, as you can tell from this webinar that we are hosting right now, in order to ensure that health centers have the tools and resources they need to not only support the agricultural worker families and their communities, but also their staff at the health center. So we certainly encourage you to visit all of our websites. HRSA, of course, many of you know HRSA. They are the ones who oversee the health center program within the Department of Health and Human Services. They have a website that we encourage you to go to. And also, in addition to us, there are many other national training and technical assistance partners. There are actually 22 in total. And all of the different national training and technical assistance partners, we also all work collaboratively. Each national training and technical assistance partner has, again, its own expertise and provides training and technical assistance to health centers. So these are a list of the various national training and technical assistance partners. Um, and we certainly encourage you to visit them as well if you have not visited them already. There is also the clearinghouse. It is currently down for maintenance, but once it's back up, we encourage you to go to the resource clearinghouse. This is where you can find the training and technical assistance resources developed by all the national training and technical assistance partners. So if you don't remember Farm Worker Justice, you can go to the Health Center Resource Clearinghouse and find our resources on there, as well as the resources of the other national training and technical assistance partners. The Farm Worker Health Network specifically, so in addition to this webinar, we also developed a key resources for agricultural worker health. And so we encourage you to access that resource. You can click on the link. We will also put it into the chat. And that highlights resources from each of our organizations for you to use at your health centers, and also provides information about our organizations and the websites so you can go for more information. Before we go to questions, we ask you to fill out the post-session evaluation. And we also encourage you to, again, visit our websites. And if you have any questions, please put them into the Q&A pod. And with that, we are going to finish the recording. So thank you for